Hey everyone, we are here in chapter 23, slide 13. We're going to talk about veins and different types of cardiovascular conditions, at least some of them. We're talking about venules right now. Let me actually go back to slide 11 to show you an example of a venule in this illustration. Blood comes out of the heart. So if you can imagine a heart over here. When you come out of the heart, that's an artery. Arteries branch, and then eventually you get branching to really small arterioles. So here we have an arteriole. That arteriole branches to capillaries, whether it's sinusoid or fenestrated or continuous capillaries, and that's where you have gas exchange, nutrient exchange, waste exchange of stuff in these capillaries. And then you return the deoxygenated high waste blood in veins. Specifically, the smallest veins are known as venules. So venules, we're making our way back to the heart after capillary exchange. Venules are the smallest veins. They collect blood from capillaries. They have a very thin or absent tunica media. Take a look at this histology here at the bottom right. You can see a large blood vessel shown here. I believe this is a muscular artery. The lumen is this way. Really big, off the page. We just talked about capillaries, and capillaries are tiny. Look at the single layer of endothelium there. Arterioles, we've also discussed. Not only do they have the endothelium, which I'm outlining here in green, but they also have tunica media, which has the smooth muscle and elastic connective tissue. Venules also have endothelium. They don't really have much of a tunica media. What that means is they don't change size much. They don't really vasodilate or vasoconstrict. But they do have a tunica externa, which I'll color in dark blue. The dense, irregular connective tissue protecting the outside. You can also see venules overall have thinner, I kind of overdid that, overall have thinner walls and larger lumen. That's what we discussed in the first video in the series. Veins on the whole have larger lumens. Arteries on the whole have thicker walls. In comparison to other veins that we're about to discuss, you can see here on the left, venules, you can see that if there is a tunica media, it's really small. Every blood vessel has tunica intima, and then it has externa to reinforce the outside. They're just drawing blood away from the capillaries towards larger veins. From venules, we then branch into larger, medium-sized veins. We have many venules branching to fewer medium-sized veins. So now we're converging. When we were with arteries, we went from fewer elastic arteries and then diverging to more muscular arteries, diverging to many arterioles, diverging to the most amount of capillaries, converging to venules, converging to medium-sized veins. You can see the difference in medium-sized veins compared to a muscular artery, which I'm circling in red. Muscular artery has a very thick tunica media. Medium-sized veins, thin walls on the whole, but large diameter. And because they have larger diameters, they often even collapse a little bit. One other distinguishing feature of medium-sized veins is that they have valves. They have one-way valves. We saw valves in the heart to allow for one-way flow. Valves are present here in veins, specifically in medium-sized veins. When blood is in arteries, there's pressure from the heart to keep it going forward. But after we've gone through capillaries, we've really slowed down the blood. And so now we have this really slow blood moving through veins. So how do we keep it from, we want to keep it going forward. We do not want blood to go backwards. We need valves to keep this low pressure blood from coming back. Veins have a very large, relatively, proportionately, have a large externa. In this histology here on the on this side, on the bottom center, the lumen would be right here. You have your tunica intima, a small media, so there isn't much, there isn't a whole lot of elastic tissue or smooth muscle comparatively. And then tunica externa is very big. Lots of reinforcement. You can see that they are often found alongside muscular arteries. They go in pairs, and they're often named the same things. We have a radial artery, there's a radial vein. We have a tibial artery, there's a tibial vein. Popliteal artery, there's a popliteal vein. So they go alongside one another. There's benefits to that you learn in physiology, including heat retention, but yeah, they're often found next to each other. Like I said, there are valves in medium-sized veins, and valves ensure one-way flow. If you have blood flowing in one direction at a low pressure, we don't want it to go back. And so the valves will shut close. They're one-way doors. Now there's low pressure in our veins, so how do we keep blood going forward? How are we going to propel it forward if there's no heart after capillaries? What we do have are skeletal muscles. Skeletal muscles can squeeze on veins and push blood forward. It opens up valves in one direction, but it can't go back in another. And just the act of breathing, because it expands our body, our thoracic cavity, and keeps things moving. That allows blood to move forward. So you've maybe heard the idea that if you're sitting for a long time, like on a plane, or if you're traveling, it's good to get up and stretch your legs and move around. It is really good for circulation. People who are in hospital beds for a long time, it's important that they get moved around too. Even if you're stuck in a bed, to have your limbs moved, to have your body moved as much as possible. At least that's one reason why, for circulation. You can see in this longitudinal cut, the previous histology we've seen with cross sections, in this longitudinal cut of a vein, you can see valves every few centimeters along the blood vessel, along the medium-sized vein. Venules converge to medium-sized veins converge to large-sized veins. Creative naming. Large-sized veins don't have valves, but they're really large and they return blood back to the heart. Like their counterpart, like elastic arteries, they do have vasa vasorum. So if you look in the tunica externa, you can see vasa vasorum here and here. There is a thin layer of tunica media, and of course, it has tunica intima. But the externa is very large. Contrast that with arteries where the media is very large. And in case you're curious, this is where the lumen is. Examples of a large size vein would be the superior vena cava and the inferior vena cava. The venae cavae are what are returning blood back to your heart from your upper body, head and arms, and your lower body, trunk and legs. Really large veins to return blood back to your heart. So those are all the different blood vessel types: elastic arteries, muscular arteries, arterioles, 3 different capillaries, continuous, sinusoid, fenestrated, and then 3 different vein types: venules, medium-sized, large-sized. Now on to some examples of medical conditions. One that you may have heard of is called atherosclerosis. atherosclerosis. What this is referring to is a buildup of plaque. Plaque is, in this case, cholesterol, waste, and other things that just build up. They can build up because of diet, because of exercise or lack of exercise, and even genetic conditions. So there's lots of factors that can lead to the buildup of plaque. Plaque, where is it building up? It's building up in between tunica intima and media. So if you look, let's look at this diagram first at the top right. What I'm coloring in green, that's intima. What I'm coloring in blue, that's media. So normally they should be together. There's intima, there's media. Normally they should be right next to each other, but now we're getting deposits of stuff. We have damaged epithelium. We have our plaque building up deep to the tunica intima. Not only do you have plaque buildup, but you also have inflammation. Inflammation, that what's included in inflammation is an increase in interstitial fluid. You'll learn about the specifics when you get to physiology. In our histology over here, you can see that irregular looking plaque in this space. And when you have plaque buildup, the more it grows, the more you obstruct this lumen. This lumen gets smaller and smaller. That's one result. Second, because you've got this immovable plaque, the smooth muscle in tunica media can't really change the shape of your artery. It's important that you change the shape of your artery. You want to regulate blood flow. If you can't regulate blood flow, then you miss out on things like getting blood to the organs that need it, to your muscles, to your digestive organs, to anything that might need blood. And so now you're depriving your tissues of blood when they need it. So atherosclerosis narrows blood vessels and restricts blood flow. This can be lived, you can live with this for a decent amount of time. It can get worse. If it does get worse, specifically if it gets worse to the blood vessels of your coronary circulation, then one symptom you can feel is called angina pectoris. Pectoris means chest. Angina is referring to the blockage to the pain. Ischemic means a blockage of blood flow. So ischemic chest pain, it's chest pain that you're feeling because you have a blockage of blood flow because of your atherosclerosis in your coronary circulation. You're blocking the blood that is needed for your heart to function, for your myocardium to function. So angina pectoris, severe sudden chest pain. It can even radiate. If you feel pain in your heart region, it can even radiate to your arm and to your jaw. Hopefully you can answer, why does pain radiate? Even though the problem is right here, it's radiating to your skin, in your jaw and your arm. It's because of dermatomes. It's a pattern of innervation of your neurons. So your heart is in the same dermatome as your arm and your jaw. So if you feel pain in this area, that pain can spread to other areas nearby. Obviously, if you're lacking blood to the myocardium of your heart, if you're losing oxygen because of smaller coronary arteries, that can lead to long-term consequences. That can lead up to what we call a myocardial infarction. Myocardial is referring to the muscle of the heart. Infarction means blockage, like full blockage. We colloquially call this a heart attack. Heart attack, myocardial infarction, same thing. When you fully or nearly fully block your coronary circulation, the arteries leading to the myocardium of your heart, you can see a blocked blood vessel right here. That means anything downstream will lack oxygen and nutrients, and this will lead to death of tissue. death of myocardial cells. If heart cells start dying, now your heart can't beat properly. If you can't beat your heart properly, then if your heart can't beat and pump blood properly, then you can't survive. Your cells won't get the oxygen and nutrients that it needs. This is especially, heart attacks often happen when that plaque pushes through the tunica intima and ruptures the tunica intima, causing a clot. So that would fully block. If you're just starting to build a plaque, but then the plaque gets big enough that it tears tunica intima, broken blood vessels lead for platelets to bind and start the clotting process. You form a clot, and now it's blocking the whole blood vessel. You can view this using special tracing and imaging techniques, like with this angiogram. An angiogram, you're looking at blood flow through your blood vessels, so you inject a special tracer dye. You can see this artery. You can see that it narrows out at certain points, and as a result, you get less blood flow at distal parts of the blood vessel. So we've talked about a lot in this chapter so far, and we're not done yet. In the next video, we'll be talking about specific names of blood vessels, from where you find them and where blood flows from one place to another. Whoops. So I hope you can see how blood vessels are just like in a highway. We start with larger blood vessels, we can branch off the smaller ones and come back to larger ones, away from the heart to capillaries and then back to the heart. It's like we're making a drop off and then coming back and then getting refilled at the lungs. And that's represented in the schematic here. We have high oxygen blood coming from arteries. We branch to arterioles. We exchange gases and nutrients at capillaries, collect wastes, and then return blood through venules, veins back to the heart. What we could show here is that we could show the lungs. These are supposed to be lungs. We can have that deoxygenated blood come back to the heart, from the heart go to the lungs, exchange gases with capillaries, get oxygen, return that blood to the heart, and then deliver that blood out the aorta. All right, so we have another full set of videos of this chapter, chapter 22, where we'll talk about specific pathways. Like this pathway here is very, very generic. We'll talk about specific pathways with names of blood vessels going to specific destinations. So I'll see you in the next few videos learning about blood vessel pathways. Let me know if you have any questions. I'll talk to you later.